It's called ICL, and it's changing the lives of people who have to wear contact lenses. Dr. Steve Chang is my guest in tonight's Ask the Doctor segment. He's with Nevada Eye Consultants. Thanks again for being with us.
You're welcome.
ICL, explain how it works.
The ICL is, it stands for Implantable Collamer Lens, but really it's an implantable contact lens. It's made out of a collagen type of material. Just like a contact lens, we just place it inside the eye, so it gives you all the benefits of a contact lens without having to maintain it. And the beauty of it is it is reversible.
That's incredible. So your eyes change, or you just decide for whatever reason you don't want it, you can just take it out.
Absolutely. You can change it, and if your prescription changes, you can fix it. Also, if there's a new procedure that comes on down the line, you can always remove that, and your eye is eligible for that as well.
How safe is this procedure? Anytime you talk about working with your eyes, it kind of scares people a little bit.
Of course, of course. You know, it's extremely safe. It's extremely safe. It's about this, same as LASIK procedure. You have the certain risks that are inherent to any surgical procedure, but they're very, very mild.
And it really changes. Is it one of those things with LASIK where you wake up and, oh my gosh, I can see the clock?
Absolutely, absolutely. The wow factor is tremendous. And people say with this ICL, it's like HD vision. So if you first, remember that first HD TV you saw at that's a store, it's the same kind of vision that you would get with this lens.
How long has this procedure been around?
It's been FDA approved in the United States for 5 years, since 2005. It's been around all over the world for over 12 to 15 years. So over 50,000 people have had this implanted in their eyes already.
And how many procedures have you done? I know you are one of the top surgeons. We're so lucky to have you in Reno.
Absolutely. Yeah, I've started to do this when they came out, so I've done a few hundred of these, and people are just wowed, and they do really, really well.
Do you see anything in the future, the near future, where it might be slightly changed and improved upon, or are we looking at the gold standard right now?
No, well, right now this is the gold standard. Okay. Now, as time goes on, there's always new stuff going that's being developed down the line, down the pipeline. Hopefully we'll have one that corrects astigmatism, that corrects nearsighted, the need for reading glasses and all that stuff as well.
Dr. Chang, exciting stuff. Thanks again for your time tonight.
You're welcome.
We certainly appreciate it. And that is Ask the Doctor for tonight. JK, I'm going to toss it back to you on the set.
All right, thank you, Wendy.
Do you have poor vision? Do you wear contacts? You can get them implanted. We're talking about it tonight's Ask the Doctor segment with Dr. Steve Chang of Nevada Eye Consultants. Thank you so much for being with us.
Thank you for having me.
So you actually implant a contact onto somebody's eye, into someone's eye. How do you do that?
Absolutely. Yeah, we make a very, very small incision, and this lens folds up, and we basically inject it inside the eye. It opens up inside the eye, so it actually goes behind the colored part of the eye, so you don't really see it, you don't feel it, and the eye's natural fluids just nourish it, so you don't have to maintain it.
Now, doesn't vision get worse as you get older? So do you have to change out that contact lens every 10 years or something?
Well, not necessarily. Vision changes a lot during up into your teens and tends to stabilize in your 20s, and then starts to change again later when you get into your 40s, and that's usually because a lens is developing into a cataract. So you have this period of time when things are stable. However, if the vision does change, one of the beautiful things about this lens is that it is reversible. So if you have a large change in your vision, we can easily remove these and replace it with the correct power lens.
Who is this procedure for? Anybody who wears glasses?
Well, not everyone that wears glasses. The procedure is FDA approved for people with nearsight, moderate to severe nearsightedness. In other words, people that can see things up close but not far away. Okay. People between the ages of 21 and 45, and in general, good ocular health.
And then do you have to wear reading glasses still, or does this completely take care of your vision?
Well, no. I mean, it's for people between 21 and 45 because it doesn't quite get rid of the reading glasses. Okay. So it really just gets you good distance vision.
Fascinating procedure. Dr. Chang, we
wonderful.
certainly appreciate your time tonight. To speak with him about your vision concerns, pick up the phone right now. Call 858-2222.
Coming up